Welcome attendees. This webinar aims to provide you with updates and information about the fellowship exam. I'm Julie Mundy, the Vice President of the College and also cardiothoracic surgeon from Queensland. RACS acknowledges the traditional owners of country throughout Australia and recognises their continuing connection to land, waters and community. We pay our respects to them and their cultures and to elders both past and present. Tēnā koutou, tēnā koutou, tēnā koutou katoa. I'd like to introduce the panel members for tonight. First of all, we have Mr. Adrian Anthony. Adrian is the Chair of the Board of Surgical Education and Training. He's a member of council and he's also a general surgeon based in Adelaide. He'll appear shortly on your screen, I hope. Welcome, Adrian. Our second panel member tonight is Professor Chris Pike. Chris is the current chair of the Court of Examiners. He's a member of council and he's a general surgeon based in my wonderful hometown of Brisbane. Like most surgeons, he's often late. Here we are. Welcome, Chris. Next, we've got Cathy Ferguson. Cathy's senior examiner in otolaryngology, head and neck surgery, Specialty Court of Examiners. She's an OHNS surgeon based in Wellington and a former past vice president of the college. And she's here on time. We also have Associate Professor Phill Carson. Phil's the immediate past chair of the Court of Examiners. He's the current censor-in-chief at the college, a member of council, and he's a general surgeon based in Darwin. We also have Professor Julian Archer behind the scenes, who will be collating questions. He's the Executive General Manager of Education at RACS based in Melbourne. And as our panel moderator tonight, we have Dr. James Churchill. James is the chair of the RACS Trainees Association, and he's a final year set trainee in neurology at St George Hospital in Sydney. So thank you to the panel for taking the time tonight to answer your questions. And I'll hand over now to James, who is your moderator this evening. So thank you, James.
Thank you very much, Julie, and thanks once again for our panellists for joining us this evening. I'd like to also particularly thank trainees and others who've sent in questions in advance of tonight's webinar and for your feedback after the last webinar that we ran like this 2 weeks ago. As a panel, we've looked through these questions and we hope to address as many of these as possible for you tonight. If you do have further questions that come up during the meeting tonight, you can also type these into the questions pane in your control panel within your GoToWebinar, and you can send these through at any stage, and we'll be addressing those. And with thanks very much to Julian, who's off screen. So tonight we're going to cover a series of topics regarding the fellowship examinations, and we realise this is a really important topic that trainees have got many questions about. So specifically, we're going to talk about what effects the coronavirus pandemic has had on RACS's ability to conduct the fellowship exam as usual, and how we as a college have approached creating a modified or essentially new exam. Secondly, the details currently known about what a modified fellowship exam will look like. Thirdly, the contingency plans and covering a few of the many what-ifs in this situation that we currently find ourselves in. And finally, indicating what the next steps on from tonight will be to make sure that you as trainees are aware of the plans for communication particularly. So we'll start tonight by talking about the coronavirus effects and the effects of the pandemic on RACS activities. And I want to address our first question to Phill. So first, Phill, what are the risks and barriers to RACS running the fellowship exam in a business as usual case as we have before? And can you talk a little bit about what RACS's ideal fellowship exam looks like?
Okay, thanks, James. So certainly the whole question of assessing risk and getting through risky situations and preparing for risk is a thing we do as surgeons all the time. So we're just applying this in a slightly different way than our normal clinical day-to-day job. Business as usual for the exam, as some most of you know, and some of you know intimately, perhaps have done it before, involves congregating in one city, a large number of candidates and examiners, and involves travel to that place. It involves using hospitals for both vivas and for clinicals, and it's a face-to-face experience between the examiners and you as candidates. And that's a well-tried, tested thing which has evolved over the years. It certainly hasn't stayed the same, but the evolution has been very careful and stepwise. We're not able to do that at this time, and certainly, as you realise, we had to cancel the May exams, and we were facing potentially a terrible time in our two countries. But very fortunately, we've got through that first wave in both countries without many of the more horrendous situations that others have faced throughout the world. However, there is likely to be ongoing restrictions or ongoing problems with running the exam as normal for the next 18 months. And they will be unpredictable, and they may be local, and they may come on at short notice. So the risks are if we run exactly the same as normal, that we maybe have to cancel the exam. That's one big risk we don't want to, we want to try to avoid as much as possible. On the other hand, if we change the exam enormously to get away from all those things, that would involve huge change at one time, and that's another risk. And so the court and the exams department are travelling through a middle course to try to minimise both of those risks, to minimise the chance of cancelling as much as possible, but also to make some changes that will, will minimise that risk of cancelling, but still enable the exam to go ahead. So one of the things we'll keep emphasising is that the exam will retain all its essential elements as far as the competence we assess, and the marking grades and all that will be exactly the same. So from your preparation point of view, it will be the same. But the ideal exam then retains all those elements, but builds in a degree of flexibility, so that if there is a problem with a site, there'll be a chance to change sites. If there's, we just want to minimise the chance of cancelling. There will possibly be some technology introduced, at least for perhaps observers or so forth. And in introducing that technology, we'll also to be very careful that's not disruptive to the exam process. And so overall, the ideal exam will be an exam that's more flexibly delivered. It will be slightly changed in the method of delivery, but it will be a familiar exam to anyone who's done it before. And certainly the preparation for the exam will be the same. And importantly, I think the ideal exam in this current climate will be a partnership between you as trainees and the college and the examiners, because we're both feeling our way through this new world, and it will involve some give and take in terms of lack of smoothness, I guess, in both communication delivery, because things are changing so much. So that would be my picture of the ideal exam in this environment.
Thanks very much, Phill. I suppose, Chris, I wonder whether you could perhaps give us an idea as to what the college has been doing and how we've approached the problem of creating this modified exam. Specifically, who's involved in making decisions about this, and considering that trainees often have most contact with their specialty training boards, what's the relationship of the boards with these processes?
Thanks, James. So I'm chairman of the Court of Examiners. We're a group consisting of the senior examiner, that's the senior examiner in each specialty, and two deputy chairs, one from Australia and one from New Zealand. We've been meeting regularly for 6 weeks, trying to get the format correct to run the fellowship exam later this year. We've done some in-depth modelling of different scenarios, including cohorting, whether or not we could travel between countries or between states. And we do have a number of models out there which would be kind of fallback models. But at the moment, we've settled on a model where international travel will not be viable or not be allowed, and exams will be held in New Zealand and Australia a week apart. When it comes to the relationship with what else the college has done to get the structure right for this exam, the college council has got involved early, and a coalition of the willing between the college council, the Court of Examiners and examination departments have formed a working group which has been able to workshop the models and have also been able to look at what is possible, what technology will be necessary, what dates can be set, and whether face-to-face meetings would be allowed, or at least what can we do in this scenario of having face-to-face meetings. So to that end, the senior examiners, their relationship with the training boards is that many examiners have been chairs of their training boards already, and they have regular contact with the training boards, but not in a formal way. The exams have to set questions at a level of a first-year consultant, but it has to address the curriculum and the competencies of the college. And the training boards also set the curriculum from which the examiners mount their exam. I think I might leave it there, James. I think we're going to cover most of the other things. So at the moment, so College Council, the examiners, the examination department, and all the senior examiners have formed a working group to formulate this exam for later this year.
Yeah, thanks, Chris. I think you're right in that we will cover a lot of the detail. I suppose that's it leads us on to the next part of the question, or the question set for tonight. I'm sure that trainees would like to understand the detail as to the where and when the exams are currently planned for, both the written and the clinical and viva components. And if there are more specifics coming in the future, what kinds of timeframes we're looking at for those details being released.
The shorthand answer is that it will be pretty much the format of a normal exam, but just set around about a month later. So at the moment, we have a tentative date for the writtens for the 8th of September across both countries. And we have examinations on consecutive weekends. The first exam in New Zealand on the 10th and the 11th of October. And the second exam, that will almost certainly be in Auckland. And then the second exam, second sitting of the exam on the 17th and 18th of October in Melbourne. The choice of Melbourne was that it has numerous hospitals with outpatient departments. It has all the examination staff, but most importantly, it's got flights from every other capital city, whereas some of the other centres don't have that as much. So that's why we chose Melbourne. So just going through those dates again, I think it was sent to you by an email earlier today. So the writtens on the 8th of September, and the vivas on consecutive weekends, Auckland 10th and 11th of October, and Melbourne 17th and 18th of October.
Excellent. Thank you very much for that, Chris. And as we said, that will be made available to trainees in written form as well after the meeting, but that should have gone out by email today. So, Catherine, the next question that comes up from many trainees is whether their specialty is going to be holding an exam, because we're aware that each of the specialties do run slightly different processes. Yep. Will all the specialties hold an exam this year, and what happens to trainees if their specialty does not?
The short answer is yes, all specialties are planning to hold an exam this year. And we sincerely hope that is going to happen. The slight caveat for that is our modelling currently, which is planning for exams on 2 different sides of the Tasman with no international travel, means that for a couple of smaller specialties, there may only be one New Zealand-based candidate, and therefore it's not felt that it is viable to be able to hold an exam for those people. So we sincerely hope that we will be able to have international travel so that they can get to Australia to examine, but logistically I think the boards and the senior examiners feel you can't really hold an exam in one country for one person. So there may be an issue and a couple of smaller specialties.
Yeah.
But we're
Okay.
certainly trying to
Thanks.
find ways around that.
Yeah, thanks very much for covering that important question.
If they, I suppose, and then the answer is if they can't sit the exam then and can't travel to sit it in Australia, then they unfortunately will have to wait till next year.
Adrian, I suppose the other question that's come up recently quite a lot and kind of leads on from that question is who's eligible to sit this modified exam for this year? And can trainees who would have been registering for the September exam sitting also sit in addition to those registered in May? The college has put out some principles around this, but I wonder whether you might be able to expand on what some of the capacity issues that we currently face are.
Yes, thanks, James. And so those who will be able to sit are those who are obviously signed off, so that they need to be signed off by their training boards. Because there is one exam that is being planned for at the end of this year, from a capacity point of view, it's not going to be possible to actually hold the exam and accommodate for every single trainee who were planning to sit in 2020. So priority will be given to those who have actually registered to sit in May already. And then depending on the specialty, if there is capacity to accommodate for more candidates, then it will be opened up to those who may have been planning to sit in September. So that is something that I know that trainees are actually very keen to have some certainty around. And in fact, one of the questions that has come online is about that why can't we extend the exam later on this year, hold it over a few more days, maybe even a few more hours each day. The logistics of actually trying to accommodate for that does increase risks to the exam. And it just would not be possible to accommodate for 2 sittings of an exam in one session or in one period of time. Priority will be given to those who are planning to sit in May. If there happen to be some capacity, i.e. capacity as in the venue or the amount of examiners available, or in case some trainees who are planning to sit in May choose not to sit in May, then those extra vacancies will be opened up for others who are eligible. And I don't know whether Cathy or Chris may want to comment on the capacity issue, specifically why we can't expand this modified exam session.
Yeah, please do.
Yes.
I might go to Cathy first, perhaps, on that one.
Oh, okay, I think it's largely to do with the number of examiners and the time it takes for each to run each viva and the number of examining pairs required at a time. And I know in one specialty, I think the planned May exam was going to be the biggest exam that they'd ever run, and they were struggling, I think, to find enough examiners to be able to do that. Examiners can't just keep on examining candidate after candidate after candidate, and I think you know, for the same viva, I think that would actually be very disadvantageous to be the last candidate in that setting.
And Chris, any other comments on that?
Oh, well, Cathy's completely correct. It does come down to mathematics in the end. So at the moment, there are 2 examiners for every 3 candidates, just as a general rule for the ratios, and that allows for any given viva in the exam that the examiners would only see 3 candidates sequentially. You can go up as much as 4. We used to do 4 candidates for every examining pair. I think if you get much above that number, you're looking at perhaps the last candidate not having exactly the same exam as the first candidate in any given viva. So I think it's a fine balance between numbers. I mean, the numbers are pretty big anyway, and the amount of time off work for the examiners is it's all done pro bono, as everyone would understand. the amount of time off work also comes as a feature there, and trying to get enough examiners to run 2 exams. It's not to say that the examining courts have not got their work together. At the beginning of every year, like in February each year, each specialty would set brand new each year 2 or 3 exams completely ready to go. So the actual material is there. It's just the logistics of who is available between now and the end of the year, given that I think October would be the first possible time that we could do it.
Yeah, okay. Look, thank you for that. Julie, you've got your hand up there.
So James, the other confounder is that just as we're assuming that the Tasman will be closed for transfer of trainees or exam candidates from one country to the other, the same goes for the examiners. So where you would normally be able to have Australian examiners go over to New Zealand on the weekend of 10th and 11th, and then the New Zealanders come over to Australia the following weekend, we're not going to have that luxury. So both pools of examiners are going to be a little restricted in that respect.
No, thank you very much for that insight there, Julie, as well. I suppose, Chris, the trainees at the moment are wondering what this exam will look like and really what the main things to be aware of in terms of differences to the usual. What are the major features of this modified exam? We've covered some of them already, but I suppose just in summary, what's different in terms of the way that we plan for this?
Sure. So the model we've chosen to go with is that we'll be able to do face-to-face vivas, and already some of the specialty courts have told us that they will hold clinical exams as well. So in vascular, pediatrics, neurosurgery and plastics, your exam will be identical to every other year in the last 10 years, well, given that it subtly evolves every year, but that your format of your exam will be unchanged. In general surgery, orthopedics, otolaryngology, head and neck surgery and cardiothoracic surgery, the clinical exams have been modified somewhat. The exam tests complex reasoning and covers many of the 10 competencies, and it really of the college, and it's set at the level of the criterion really as the first year specialist, and those modified segments will be largely clinically based scenarios with stems which are clinically based as well. So we're confident the same subject matter will be covered, and that the complex reasoning which we assess will be covered to the same level, and that there'll be no discernible change in the quality of the exam as we provide it this year.
Yeah. Okay. Well, I suppose in summary, that's pretty reassuring that the, I suppose to reiterate one point you covered there, which is that the content that we're examined on certainly won't be different to the usual. So therefore we can reassure trainees that the things that they've been studying for over the past 12 to 18 months is very important, that that's consistent and that it certainly is still relevant. So Phill, I might just hand over to you for a second.
Sorry, just a question came through and I just realised we are talking about trainees, but we're also talking about IMGs too. So all these things apply to IMGs equally, particularly if you've booked for the exam in May. As an IMG, you'll be given first preference in October, and I guess we just need to keep that in mind as we go through if there was any differences. But at the moment, I think everything we discussed is equally applicable to IMGs.
Thanks very much, Phill. Yes,
James.
sorry, was that Chris? Yep.
Yeah, it's fair to say as well, I suspect there's a lot of insecurity about any change in the exam. The course of examiners work to the curriculum, they work to a blueprint for the exam, and there's quite a bit of built-in redundancy. Most of the subject matters are covered more than once in any given fellowship exam, and it would be highly unusual for any modified segment to be covering the one particular thing that isn't covered somewhere else in the exam at the same time. That the senior examiners are very conscious of the fact that they have to cover the same material in a number of different ways during the exam.
Yep, absolutely. I think that comes to a number of the questions that we had regarding content of exam and what the exam will cover. So thanks very much, everyone, for your opinions on that. Cathy, sorry, was there also a comment just on that as well?
I just wanted to say that, you know, the examiners are really very keen to try not to modify the exam any more than they absolutely have to, and you know, and are really concerned to make it the same experience for the trainees as it always has been wherever possible. And certainly in otolaryngology, the fact that we are not going to have patients in our clinical segment is not going to make an enormous amount of difference. We've found some other ways around that, and in fact it'll probably be a more uniform exam for all candidates as a result.
Okay. So one question that does come up from time to time also is regarding progression through training. And Adrian, I might just ask a quick question at this stage from trainees that are worried about completing their training time prior to them having an opportunity or passing the exam. What can we tell trainees who might be worried about completing their time but not having gotten through the exam? How will these scenarios be generally dealt with?
Right. Okay. Thanks, James. So those, I guess that fits the definition of an exam pending trainee. So they are trainees who have met every component of their training but haven't got their exam. Is that what you're asking about, James?
Yeah, so say a trainee has completed all of the
Yep.
time requirements and they've gotten to the end of their rotations satisfactorily, and they were planning to apply in September and sit, but they haven't been able to. What happens for that trainee?
Okay. So I guess there's a couple of situations. There's one where trainees who are planning to sit this year actually get a chance to sit this year, end of this year, and then they don't pass the exam. Or the other scenario, which is what you've just identified, and that is someone who wanted to sit this year but did not get a chance to sit this year. In both of those scenarios, what training boards are considering is, and would really seek to try to support, is to ensure that trainees are not disadvantaged and would try to allocate them to a training post. Now, that's not universal. What training boards would like is that trainees who believe they're in an exam pending situation, that they, and if they feel like they need another term or two in an accredited training position, they should contact their training boards directly. Training boards will consider individual trainees' situations. So it is assessed on an individual basis. They will also need to consider the number of trainees coming through who may well need to take up late set positions, positions that that maybe the exam pending trainees also looking to occupy. And the training board will then make a decision about whether it's able to accommodate. So if at all possible, training boards understand that in this COVID situation, there are some unusual circumstances that trainees, not through their own fault, may actually need to have some extra time in training to support them pass the exam. They will seek to accommodate that. The issue, I guess, is that the training boards can't promise that. It has to be assessed on an individual basis, and it also needs to take into account the available positions and also the number of trainees coming through. So my strong advice is that trainees seriously consider what are their plans for next year and whether they need to be contacting the training boards to get some advice and maybe some support about being allocated to an accredited job next year. Because it's not normal, generally it's not normal for exam pending trainees to be allocated to a accredited job the following year.
Okay, thank you very much for that, Adrian. I wonder at this point, Julian, I know that you're off screen, but you are with us and you've been party to many of the questions that have come through during the chat. It's probably a good moment for us to pause about halfway through and just to see if there's any particular themes that we haven't covered that you'd like to fire a question off to any of the panelists just now.
Certainly, thanks, James. So one question that's come through is, does RACS have any information around flights to examination cities, their availability and costs?
That sounds like your department, Julian.
Yeah, I suppose that's obviously a challenging question at the moment. Julian, do you have any advice that you would give trainees who are in that question as to what's happening with flights? Obviously, there's many things changing at the moment in the airline industry. Obviously,
indeed they are. Yeah, thanks, James. So we've obviously been monitoring these things as a college in relation to all college activities. We're aware that, for example, in Australia, REX is looking to start to provide major city flights alongside Qantas. But generally speaking, at the moment, it is actually quite hard to book far in advance. And certainly, there are limited flights, so it is quite difficult to get a place. But I think this is where, of course, the preparations that are happening now are 5 months in advance, things are likely to look very different, we hope, by then. I suppose it's fair to say that the relationship of candidates to these sorts of costs has always been that the candidate has to take responsibility for organising their travel and making the appropriate arrangements, including insurance. And I think that's something that we're all going to have to look at very carefully as we go forward now. And so all of that would still apply. Clearly, if the college were to have to cancel exam, that would be different in terms of the cost of paying to do the exam. But certainly, as has always been the case in regards to additional costs, they would sit with the candidate.
Okay, thank you. There's also, I see, sorry, Julie, go on. You have a question there.
Yeah, so James, if you look at the projected plan from the government for opening back up, they're talking about opening up things by July, and certainly, Qantas is talking about opening up more flights from sort of mid-June. So I think by July, probably we'll start seeing more flights open up. But it's obviously just going to have to be one of watch and see. We do actually have a precedence, and unfortunately it's only old people like me that remember it, but in 1989 there was a pilot strike in Australia, and they brought planes including crew from America West Planes. They employed Hercules, all sorts of things, and I had to get to fellowship exam in Adelaide at the time from Brisbane, so I can assure you that these things can be problematic, but I think as the country opens up, then the flights will open up with it. As to the cost, though, certainly when I had to get my flights to Adelaide, there was no such thing as a flexible fare. There were no cheap fares; they were all full cost fares. So I think people need to be aware that that may well be the case.
Okay. Cathy, I'm aware that there are a few questions coming your way regarding the clinical stations of exams, and I wonder whether you might want to take up one or two of those questions at this point.
Yeah,
and address those.
Yeah, there's somebody's asked how many extra positions for the exam are we anticipating to have available, and I really can't answer that at the moment. It certainly, as everyone has said, those people who had registered for the May exam get priority. We're expecting that most people will still want to do that exam, but one thing that I don't think we have covered off is that people are anxious about sitting a slightly modified exam format. I think the idea is that they can defer without any penalty, and I think the number of extra positions is going to vary per specialty, and I can't give you those specific answers at the moment.
Yeah.
There was another question
I think, Cathy,
Yeah.
I might
Yeah.
just take the next one as being one on clinical patients in the exam. I agree with you. I'm seeing many questions on that, and I might direct that one to Chris Pike, just on particular exams that will and will not involve clinical patients, i.e., real patients in the exam, just to see if we can try to get some clarity for trainees on that tonight.
Yeah, so I'm busy trying to answer some of the questions coming through, which are very good.
Yeah, thank you.
We're assuming at this stage that the restrictions were as stated by the federal government. By early June, we're expecting that we'll be able to congregate in groups of 100, and that essential services will be opened up, such as university exams. We're pitching ourselves at that level, and we're assuming then that interstate travel will also be allowed. A number of questions regarding that, but not international. So we think that the senior examiners, the working group, the counsellors and the examinations department felt that with sufficient marshalling that we would at no stage have a group of 100 or more congregating anywhere in the exam. Certainly in a clinical viva, for an essential service, we don't see that there would be a problem with candidates being with a patient, and 2 examiners can remain their social distance of at least 1.5 metres. So I think that the actual practicalities of that shouldn't present too many problems at all.
Yeah. Okay. So at this point, we might
James,
move on to talking.
James, can I?
Yeah.
Yes, I had a question on. Thanks. I had a question online, which I thought I may ask some of the panelists an opinion. This one is about a trainee who feels that maybe they have a particular reason to be considered for one of these vacant positions because they didn't apply in May. So for any candidate who feels like they have a particular reason or some factor that should be taken into consideration, the question, I guess, relates to how will the college determine which candidates will actually be offered to the vacant positions if there are vacant positions beyond those who are applying from the May exam? Because I don't particularly know the answer to that.
I suppose I might throw to Phill on that one, or Chris. Yeah.
I think that people in that position should put in, along with their application, put a note into the exams department with that. And I guess there will be there will be some exams which will open up positions, and that's the time to put it in. And with a note like that, that would be taken into account when we're looking at if there was an excess. I think well, yeah, I'll leave it at that. It's all about communication in this era of change, and I think if you just give those facts to the exams department, that will be taken into account.
Chris, I realised that I might have cut you off there just before. Was there anything else to add to that?
I was hoping Phill would answer. I mean, every year there is a certain amount of tension around the actual numbers for the exam and whether there's sufficient examiners, and that particular problem will have precedence as well. I have to say, previously we've been able to use travel to get around the problem. We could extensive candidates in Australia might go to New Zealand or vice versa. Obviously this year is a little different, but look, I think what Phill said is perfect. A little note to the exams department at the same time as you're registering or trying to register for the exam, and be taken into account and considered as sympathetically as possible.
And Julie, thank you.
Yes, so those people that didn't register for May, they'll still need to be signed off by their training board before they can apply or be approved to sit in this exam. So if they believe that they've got some hardship by not sitting, perhaps they also need to liaise with their training board.
Yeah. Okay. Chris, back to you.
Just as Adrian had an interesting question, I've got one for him. That's a good question. Do we have to seek another letter of approval to sit for the exam? I think if you signed off and had the letter or May, that wouldn't be necessary.
No, it wouldn't be necessary. That would be some very unusual circumstances. I guess the only situation I can think of where a further sign-off or repeat sign-off is required is if something had happened for a candidate who'd already sat the exam and didn't pass that exam, and then there may have been some requirements to try to address for that candidate, then that candidate may need to have specific sign-off. But once a candidate is generally signed off, then you don't really need to seek sign-off for each subsequent attempt at the exam.
Yeah. Okay, I think that's fairly straightforward. Thank you very much for answering that, Adrian. There's a really important question here, I suppose, which is that if Australia or New Zealand find ourselves in the midst of a second wave of coronavirus that occurs any time between now and the exam dates that we've put in place, what happens? And I suppose, Phill, this is probably a question that's it's a fairly existential one for what happens for this exam, and I might just throw to you for a comment on that.
So that was certainly, this has been the basis of our planning, I guess, that there will be an uncertain future. And it's clear if there's a total lockdown or a total overwhelming of our hospitals, the exam would have to be cancelled. It wouldn't be able to proceed because of travel restrictions and certainly clinical needs, as we anticipated it might be like in May. It's more likely, though, I think the scenario is more likely that the second wave will be regional and not throughout both countries at the same time. And that's certainly as you all know, that's the hopes of the public health people, that they'll be able to spot fire. And so it's more likely that it will be there'll be some restrictions or regional restrictions. And certainly some of by taking the clinical patients out of the bigger exams, the orthopaedic and general surgery have planned to do without hospital patients, that increases the flexibility and reactivity to such a situation where hospitals would no longer be available. There's smaller exams, more likely to be able to, smaller specialty areas are more likely to be able to still sneak in that context. So. And there is some ongoing planning for changing venues at a relatively short notice too. So there's a backup venues being things. So there's some flexibility built in there, both by the modifications in the exam and also in the forward planning as far as locations go. So there will be a point, we certainly built that in. The scenario was considered, in fact, first, can we have a totally electronic delivered exam, where there's no face-to-face? And all the courts came back very clearly that couldn't be the same exam if we did that. At such a short notice, and would introduce all sorts of risks that wouldn't be acceptable, both to the examiners or to you as potential candidates. So we went from there back to just holding the stock normal exam, and that's clearly got the risks with this. With potential cancellation. And so these modifications have allowed us to be potentially more nimble in both where we can hold the exam physically, both in location and in the actual clinical scenario, or the buildings, etc., which has given us a more chance of being able to hold it in the face of that a rolling second wave, if you like. I think, like I said, if there's a total disaster happening, it will be cleared, and nobody will probably want to do an exam in that context, because they'll be very much needed on the clinical front.
Thank you very much for that, Phill. Any comments from our other panelists on that particular question? Obviously, it's a big question, and no one has the answers at the moment as to what's likely to happen over the next few months. I'm just aware that there might be other comments for us to consider on that one.
I suppose we have talked around the idea of having multiple exams running at the same time across multiple states in Australia and New Zealand, and I think we've decided that we can't do that, partly really because of the distribution of examiner numbers. If examiners weren't able to travel interstate, then it it wouldn't be possible to hold the exams in multiple states.
And Chris?
James, it's a very good question, and we have done extensive modelling on what is available in the lockdown situation. I would point out that some years ago, after the Christchurch earthquake, that an exam was moved venue from Christchurch to Sydney in the space of 4 weeks. So there can be great agility in the college if the need is great enough. There's always a balance between what is safe and prudent and what is necessary, and we would take a lot of advice before proceeding in a larger lockdown situation.
Okay, thank you. So I suppose we've done some work on contingencies as well, and one question that does come up from time to time is that if we do rely on technology in any sense for an exam, then what kinds of processes does the college have in preparing for situations where technology fails us? And although we can help to prevent that as much as we can, we all know that technology is fallible. Chris, I wonder whether you might just want to touch briefly on what kinds of thoughts the Court of Examiners has about protections for trainees and examiners in those situations for when technology isn't quite working the way that it should.
Good question, James. I thank you for your feedback earlier to us about the use of technology. Look, there have been a number of simulations performed where we have one distant examiner and one proximate examiner in the room with the candidate. And although these things are quite possible for vivas, it seems something that can be done relatively easily, provided the technology doesn't fail to the distant examiner. I think for the clinicals, it would be very hard to do that. Technology in some courts, the neurosurgeons in particular thought that they could perform, that they could assess a clinical by doing a video of a candidate doing an examination of a patient even in their own hospital, and the examiners then looking at that and forming an opinion regarding the adequacy of the examination of the candidate. Despite that, everyone is afraid of technology failure, and I think overall that the feeling is we would rather not sit the exam than depend on technology for every viva.
I think that's a really important message to have out there, that we're trying to make sure that the exam process that we run is a safe one for trainee, for examiner, and that we're not essentially ransomed to Zoom working on the day, which, as we all know, is a fraught process. So thank you very much for your answer on that.
Yes, we do have some track record with that, with running the electronic written exams, and we all are obviously the lesson the College of Physicians learnt with their failure of the exam was very pertinent. But as we rolled that electronic delivery out, there were many safeguards put in, including immediate saving on site, as well as and not relying just on interconnect or an instantaneous internet connection and so forth. So certainly any technology in the way of introduced in exam would have those sort of backups that would be introduced very carefully, with an immediate recording backup, as well as relying on an internet connection.
I think we had Cathy on that one as well.
Yeah, I just wanted to say that the examiners, as I mentioned before, really would like to try and minimise disruption to candidates as much as possible. And so we felt that having one candidate in the room and one examiner and one by Zoom would just be too disruptive for the candidates, and that would change the exam irrevocably in our view.
Okay, thank you. So we've got about 10 minutes or so left now before our scheduled finish, and I might turn now to next steps from here. Many trainees are now thinking about what life beyond 2020 might look like, and whether we as a college expect that we would run, I suppose, what the May 2021 exams would look like. Naturally, some trainees that might not be sitting the exam this year are going to be thinking about that time, and it's probably the right time for us as trainees to think about whether should we be starting our study plans for next year on the basis of what's likely to happen. So Cathy, I think I might just ask you, what's the thoughts at the moment about what May 2021 will look like?
I mean, it is a little bit like crystal ball gazing, but I think we are committed to having 2 exams next year, so May and later in the year. But again, you know, if there's an absolute disaster and lockdown, then we'll be back to square one again. But certainly, all our premise has been we try and get an exam. Initially, we were hoping we would be able to get 2 exams in this year, but I just don't think that's possible. So we get 1 exam in this year and then go back to normal next year.
Okay. And Phill, what process happens from now in terms of communication of what we've been talking about tonight? When's the next update planned for trainees? Obviously, there's a large number of questions that have both been answered, but are likely to come out of what we've been talking about tonight. And how is the college approaching the question of communication with trainees at the moment?
Well, I hope you've all had some, a couple of letters now from us, and that will be obviously one way of going on. Certainly these webinars have been great to be able to get your questions back to us live and just touch you where you're feeling anxious at the moment, and that's been good too. We have several other webinars, but they won't directly relate to, or won't be concentrated on the exam. So in 2 weeks' time, we've got one for the preset group talking about, you know, what their very real anxieties too about the cancelled courses and getting into set. So I know many of you as trainees and IMGs watching will be mentoring people coming into set. So if you just make them aware of that that webinar. The week after that, there's a webinar for supervisors, which won't involve you as a group so much, but obviously very relevant to you as a group, and just talking about ways and innovations that people have managed to keep on doing worthwhile and intensive surgical training during these hold-ups, and looking to the future for that too, trying to learn from that and going forward. So there will be, there is the college website with the COVID you know, information page, and the education related items, including exams, etc., will come out on that. So keep an eye on the college webpage, and for any significant changes, we'll aim to make a trainee IMG exam focused communication to you. So lots of ways, and we once again, I think, like we said the last webinar, I think this is certainly one way to actually for you to put a face on some of the people behind the scenes making the decisions, and just want you to be very aware that we are, you know, have you very much in mind in all this. It's yeah, there's lots of work and lots of consideration, careful consideration of risk, but really we're trying to actually do the very best to get you through your surgical training, and in this case, the the exam components of it.
I wanted to acknowledge the fact that tonight we have had a large number of questions come through as we've been talking, and apologies if that means that occasionally we've been somewhat distracted in trying to answer those questions as well. If we don't get a chance to cover all of these, we are hoping to integrate these into the FAQs that go onto the website, and also, of course, to look at these in what we cover in future communications and updates as well. And there's very good questions in there, many on the implications of progression if people can't register to sit for the upcoming exam, and we recognise that that's obviously a very stressful scenario to be facing. So we've just put a link on the website, on the chat just now, to all of the webinars that we have run, and you'll also be able to find more information there. In the few minutes that we've got left just now, I know that Adrian, you wanted to briefly provide an update on some of the other exams that the college runs, just because we've covered the fellowship exam well tonight, and there is some important information about some of the other specialty specific exams that we feel important for trainees to hear from us. Adrian,
thank you, James. Yeah, just a couple of comments. There are two sets of exams. I guess the The main one for some specialties, and this doesn't apply to every specialty, but some specialties have in-training examinations. So we call them specialty-specific exams. Orthopedics has one, plastics has one, and some of the other specialties have them. So for those that were meant to be sitting the specialty exams this year, specialty-specific exams this year, and they haven't run so far, there will be those boards who wish to hold them. There will be an opportunity to hold them later this year. So the college will provide the resources to hold those. Most of them are online examinations, and that's the format. For those who are not able to access those specialty-specific exams for whatever reason, either it's not been held or they choose not to sit this year because of situations related to COVID, then training boards will allow those trainees to still progress in their training. Obviously, they'll look at their other parts of their training, particularly the clinical content or the clinical component of their training, but the principle is to try to ensure that trainees continue to progress, and then they will have the opportunity to sit the specific exam next year. So there's a fairly high chance that those exams will be conducted next year if they're not conducted this year. For the clinical exam, the college has worked out there's really only a very small number of trainees who have to sit those exams. I think it's about two trainees who must sit that exam this year. And what it's decided is that those specialties agree that the clinical exam, it's not feasible to run that just for 2 people. And so they will be run next year. And those trainees will be given an opportunity to sit those next year. So again, they won't be held back. If otherwise they have been progressing well in their training and met all other requirements, they will continue to progress, and then they will be asked to sit the clinical exam next year. And in addition to that, the college plans to run 3 of those clinical exams next year to catch up and ensure that everybody has an opportunity to sit the clinical exam. So hopefully that reassures trainees that for specialty-specific exams, boards which want to run it this year will be able to do so. That's the plan. And for the clinical exam, that's going to be suspended until next year.
Okay, thank you. Are there any other final comments from any of our panellists tonight on big issues regarding fellowship exam, particularly that we feel haven't been addressed, or any other burning questions that you've seen come through the questions tonight that you wanted to cover in the final couple of moments?
James, all the questions, many of the questions I'm getting are to do with when what registration's open, what's the date?
Yep.
Yep, absolutely. Now, look, I absolutely acknowledge those. It's a difficult question for me to answer. I suppose, Chris, did you have a particular comment on when the college envisages those things running?
I think working backwards 3 months from September 8th would be a reasonable time. I don't want to put too much pressure on us. I know that's only 2 or 3 weeks away. I think we did promise 3 months. So one of the principles we had was that we tried to give 3 months notice of any significant change.
Yeah, certainly the 3-month principle is a very important one. The trainees, as far as I believe, are very strongly for. So certainly I'd encourage the college to stick to that 3 months. I think that's an important thing for us to finish perhaps there, Chris. That brings us to the closing time of our webinar tonight, and I'd like to thank very much all of the panellists that we've had on this evening. Hopefully trainees have found tonight to provide lots of extra information about what the fellowship exam later this year will look like. Thanks very much also to Julie for coming along tonight and for introducing us, and to Julian, who's been off screen but in the background helping to direct some of the traffic with respect to questions. It's a difficult process running these webinars in terms of collating, directing traffic on the way through. So thanks all for your involvement. There are future webinars planned, as we've discussed briefly tonight, and there's communications planned, written communication of much of the detail of what we've talked about tonight as well. So thanks for sticking around, and all the very best in work and training in the next while. Thank you.
Thank you, James.
See you.
Thank you.
Thanks.